Stroke is among the top leading causes of mortality in Malaysia and around the world. According to the World Health Organization, each year, 15 million people suffer from stroke worldwide. In 2017 alone, there were 11.9 million incidents of stroke recorded, with a prevalence of 104.2 million, 6.2 million stroke fatalities, and 132.1 million stroke-related disability-adjusted life years. The incidence and prevalence of ischemic stroke increased nearly triple in the 5 years, from 34.2 to 96.2 per 100,000 people, while hemorrhagic stroke increased at a lower rate, from 10.6 to 21.1 per 100,000 people. People who suffer from stroke will suffer from hemiparesis or one-sided body weakness, resulting in poor hand function and reducing their independence level in performing activities of daily living. Upper limb weakness and dysfunction are the most challenging impairment to restore post-stroke compared to the lower limb. Neuroplasticity is the brain's ability to form neural networks by reorganization through axonal sprouting and forming a new synaptic connection. However, this brain plasticity needs to be guided and directed to achieve intended recovery and function and prevent maladaptive behavior. Rehabilitation intervention plays a crucial role in restoring and promote neurorecovery. Neuroplasticity is the fundamental concept underpinning every post-stroke rehabilitation restoration intervention. Rehabilitation intervention has to fulfill 4 main principles: 1. Repetitive, 2. Intensity, 3. Task-specific, and 4. Biofeedback. Mirror therapy is one of the rehabilitation interventions used to promote and assist neuron recovery of the upper limb in stroke rehabilitation. It gives visual feedback by placing a mirror between the arms to treat the brain by the image of a moving non-affected limb, which gives the illusion of normal movement in the affected limb. By this setup, different brain regions for movement, sensation, and pain are stimulated. To enhance the biofeedback, sometimes the therapist will move the affected limbs in the box to create a motor proprioception sensation feedback. However, sometimes the principle of rehabilitation is difficult to fulfill. Intensity, task-specific, repetitive, and biofeedback. The problems are: 1. Intensity and repetition are very much dependent to the therapist. Due to the small space in the box, complex movement is difficult to imitate and intensity cannot be provided. 2. The motor imitation provided by the therapist poorly imitate normal or natural movement of the hand. 3. Task-specific training impossible to be provided due to lack of natural hand movement. Introducing MyERAT. MyERAT, known as Malaysia Exoskeleton Robot Assisted Therapy, is an exoskeletal robotic orthosis used to provide hand movement to the hemiparetic limb by imitating the movement of non-affected limb. This mechanism will provide more intensity, repetition, and provide proprioceptive motor feedback by imitating natural movement of the hand. MyERAT consists of 2 parts, controller and exoskeleton. The principle behind the innovation of MyERAT is combining the concept of mirror therapy into exoskeleton. Mirror therapy will provide visual that produce sensory feedback, while exoskeleton will provide motor that produce proprioceptive input. The exoskeleton at one hand will imitate the movement of controller at the other hand, such as finger movement and wrist movement. How MyERAT can solve the problems? 1. Imitate the hand motion naturally by giving motor proprioceptive feedback. 2. Can provide task-specific training. 3. Can enhance the therapy by giving intensity and repetition in a limited space in the box. Next is the mechanism used for MyERAT. The power used is battery, each hand powered by 7.4 volt 1100 mAh rechargeable battery. Programming used is Arduino IDE. Exoskeleton is designed using CATIA software. The material used is polylactic acid filament. MyERAT controller will be worn on non-affected limb, while the MyERAT exoskeleton on affected limb. The patient will undergo extension and flexion exercise for the affected limb based on the non-affected limb movement via radio frequency wave. MyERAT has 4 safety features integrated. 1. 90-degree motion restriction to prevent hyperextension of finger. 2. Hook and loop strap for adjustability and ensure strong grip of patient hands. 3. Elastic band to prevent obstruction of blood flow. And 4. EVA foam sheet to prevent skin injury from rubbing against 3D printed parts. Novelty of MyERAT. 1. One of the local innovation that imitates the movement of the hand from unaffected limb. 2. innovation that underpins the concept of neuroplasticity and principle of rehabilitation medicine. 3. Homegrown Malaysian-made innovation, integrating IR 4.0 in medicine intervention. 4. Universal function, can be adapted and adopted to other rehabilitation interventions such as functional hand training, stretching exercises, and chronic pain treatment. Uniqueness of MyERAT, universal designing process. The exoskeleton is designed and developed by utilizing CATIA software and 3D printing technology, which allow an amiable and conformable design that can fit and customize towards the different anatomical shape and size of patient's hand compared to other available robotic hands in the market. Workability and clinical applicability. The product has been tested clinically and demonstrates improves patients' motivation and compliance towards therapy. High potential to serve as an adjunct due to its simple integration, application, and patients' acceptance towards high-tech therapy. Potentially can be integrated as one of the home-based therapy component or tele-rehabilitation program. Currently, the product is at level 3 of technology readiness level. Patent. This product has been registered for copyright CRLY 00026463. Achievement. The product has won several gold awards in 2020, which is 1. Faculty of Medicine Innovation Competition. 2. Invention, Innovation and Design Exposition, EDEX 2020. Publication. 2 journals have been successfully published for this MyERAT project. 1. Integration of flat sensor with finger exoskeleton for stroke patient rehabilitation, Journal Basic Engineering Procedure. 2. Integration of flat sensor into wrist exoskeleton for rehabilitation of stroke patient, Journal Basic Engineering Procedure. We collaborate with a few international institutions and industrial organizations. International collaboration with Shibaura Institute of Technology Japan and Kyushu University Japan. Industrial collaboration with 3D Gen Sendirian Berhad. Market potential and commercialization. We receive interest in the product and its potential to be integrated into patients' care from therapists and rehabilitation physicians from the Ministry of Health Hospital Sungai Buloh, Hospital UPM, and Faculty of Science Kesihatan UiTM. 1. For rehabilitation service robotic integration. 2. Upgrading syllabus of occupational therapy student in integrating robots into therapies. Thank you for watching and please support MyERAT.